How does the electronic health record affect you? And how does it affect your loved ones, the most important people in your lives? All of us may be invested in electronic health records, or EHR, but how do we translate that to grandma seeing her doctor? We may just assume the benefits of EHR because that's our field, that's what we're going into, but how do we make sure that other people who don't really have a dog in the race also understand? I have an aunt. Her name is Aunt Tara, and I assume that all of you have an Aunt Tara in your lives in some way or another. She's around 50, she's put on a little weight over the years, but has retained her charm. And she's the one who always cooks the amazing Thanksgiving side dishes. Her stuffing this year was on point, but what was even better is this version of gravy that she makes that actually has noodles in it. Don't ask me how, but the noodles make the dish stand a step above any other gravy that I've had before. So my aunt was driving her minivan one day. She turns at an intersection and is broadsided by a car. She goes straight to the hospital. She goes to the ER, to the intensive care unit. Broken ribs, internal bleeding. She's in the hospital bed, hooked up to the monitor, when suddenly the nurses all rush over and wheel her to the operating room. Why do they do this? Well, the system monitoring her vitals noticed signs of an internal bleed and sent an alert to the provider terminal. From there, she was taken to the OR where her ruptured blood vessel was repaired and her life was saved. She was released from the OR 2 days later and made a full recovery. The ICU monitoring system that saved her life is called Process Aware. This software utilizes a provider data display that alerts them to patients that need immediate life-saving interventions. This system has been proven to have a profound effect on ICU mortality rates. Now, this is just one example of the ways that EHR can benefit patients. Studies on record sharing via EHR show that communication between hospitals decreases both length of stay and patient mortality. There are some issues with full EHR implementation, though. Where this becomes tricky is that hospitals generally only communicate with other facilities within their own network. So if you visit an ER in a hospital that doesn't share a network with your home facility, for example, if your hospital has O2 and your home facility has Cerner, then they don't communicate. It will take much more time to actually transfer your record between systems. The other main source of pushback with an EHR implementation is the providers themselves. So, I heard a rumor the other day that kids don't want to be on Facebook anymore. They think Facebook is for old people. I was astonished, partly because Facebook was the cool thing when I was a kid. And I mean, I'm not that old, right? So, I talked with a few kids who were like under 16, in a non-creepy way, and they confirmed it. Facebook is for old people who want to talk about politics and vacations and meet up with old classmates and stuff. So what are the kids doing these days? Well, it's Snapchat. Snapchat is the new it place to be. It's on your phone, it's quick and easy to use with your friends. There are enough filters to satisfy any 15-year-old Johnson County native. Snapchat's where it's at. It is the same with physicians that are trying to adopt EHR. We realize that the new thing exists, and maybe we even know how to use it. But we don't really want to go away from Old Faithful. We'd rather scribble our notes and orders and diagnoses onto a form than type it in, because that's what we're used to doing. It worked for us, so why change? Doctors want to hold on to Facebook because they're used to it, when Snapchat is the new and improved way to do things. This is a problem that healthcare facilities across the world struggle with. You can have the most advanced health system in the world, but it is ineffective because of the people using it. That's why we can't make the assumption that EHR is the obvious beneficial choice. It is the providers that give us the care and document in the record. They need to be shown how the system saves my aunt's life. They need to see exactly how the system helps their patients. They need to care about how the record is documented. To conclude, we can prove the benefits of EHR. Whether it's Process Aware or Cerner or O2 or whatever other system, we can plainly show how they help patients live longer. The primary obstructions to complete electronic records is provider pushback and hospitals that are not communicating with one another. Even with these issues, EHR is an essential tool for modern healthcare. My aunt and our whole family thanks the hospital for adopting it. How do you think EHR can benefit your family?